So the first speaker today is Professor Damien Lynch. I always, even after all these years, I always have a bit of trepidation and fear, because Dr. Lynch used to be my tutor when I was a medical student. So that kind of anxiety never goes away, even after all these years. Dr. Lynch, Professor Lynch now, Professor Lynch is a consultant gastroenterologist at East Lancashire Hospital's NHS Trust. He's also the Director of Undergraduate Education at the Hospital Trust, and now a professor at the University of Central Lancashire. He is going to talk about undergraduate medical education in East Lancashire. So I'll hand over to you, Damien.
Good morning, everyone. Thanks very much, Imran, and also Abdul, for inviting me to give this presentation this morning. It really is a great honour. I feel really old seeing Imran and Abdul sort of doing this, and I've got to congratulate them and recognise and acknowledge the contribution they've made to supporting youngsters applying to medical school over the years. And they've also, again, asked me to, again, thank you for the contributions you made for this charitable effort as well. So thank you very much indeed, but thank you. I'm Damien Lynch. I'm a gastroenterologist. I will leave it at that. So we look at the gut as well, but that's my clinical background. This is where I see myself at the moment. I'm an old man now and looking back. And when people asked me to sort of talk about do this presentation, in particular East Lancs, I thought there was some sort of common themes as well that could be taken away by everyone who's watching this presentation about what to expect in their clinical training, because whatever medical school you go to, you'll have a fantastic experience, and that includes the clinical training as well. So there'll be some themes just about the type of running through the type of program that you have in the areas that you do your clinical training as well. So having had a think about this, what I put together is a sort of 30-minute presentation, which I hope will give some insights as well. So the aims of this talk are, one, to give an insight into what happens during your clinical education and training, an understanding about it and what you're being prepared for. And I've written down personal statement and interview, because that red thing at the bottom, there'll be certain things that I suggest you may want to have a quick read up about that you can include in your personal statement, and also can talk about in your interview as well. It gives you a broader perspective. So the structure, I'm going to tell you about the health economy that we work in, the trusts, which is where a lot of students come to, but as well as primary care, the education department here, which will be replicated across the various hospitals that you go to, and then medical undergraduate education and training as well. So yeah, no one has a clue where East Lancashire is as well. This is probably a photograph from my office window. I don't think so, really. There's not much vitamin D in East Lancashire whatsoever. And if you talk to anybody down south, particularly from the BBC inside the M25, they will concur, as I'll show you later. Yeah, East Lancashire is in the northwest of England. It's about 30 to 40 minutes north of Manchester, and 50 minutes about northwest of Liverpool. But most people just drive past it to go to the Lake District, Scotland, Wales, across to Yorkshire as well. It's a well-kept secret as well. But here it is. You've got Lancashire, the Ribble Valley. There's various North Lancashire, East Lancashire, Central Lancashire, and South Lancashire. And we're in East Lancashire as well. And as I said, this is the BBC perception of East Lancashire. It's grey, it's grimy, it's industrial. It's still recovering from the Industrial Revolution 150 years ago. This is a typical Saturday afternoon, not much going on. And this is what we do for recreation as well. Bit grim, really. And even from the air or in colour, it doesn't get much better as well. So let's look at East Lancashire. Well, to the north, if I just show you, there's an M65 corridor. And if you can see my cursor there's Preston. It goes across to Blackburn and Burnley. And there's an M65 corridor. To the north of the corridor is the Ribble Valley and the Trough of Bowland. These are areas of outstanding natural beauty, but interestingly, they have the highest concentration of millionaires living there outside London. Another surrogate marker for wealth, apparently, is that they have the highest number of private car plates as well. To the south of the M65 corridor are areas of profound and significant socioeconomic deprivation and everything that goes along with that. This is a map. This is just looking at GP practices, which just mimic the sort of M65 corridor. And the red is profoundly deprived, yellow less so as well. And again, that just reflects what I've said already. And this pans out into life expectancies, and these, the data is 20 years old, but I think they're probably slightly worse. So on the vertical axis is the sort of expectancy, and the horizontal axis is over time. Now the top is the Ribble Valley, so good outcomes there. Then there's England and Wales, and right down is Hindburn, which is only a few minutes from my office where I'm sitting at the moment as well. Again, you can look at England and Wales at the top. They're really good outcomes, but Burnley, Pendle and Rossendale, again, significantly less, and they're all within 10 miles of this hospital as well. And then you can do quintiles of deprivation as well. If you look at the population within the East Lancashire health economy and how that poverty is distributed, over 60% of our patients are in the two most deprived quintiles. And that red horizontal line is the national average as well. 10% of our population in East Lancashire from the South Asia continent as well. And they're vastly overrepresented in the most deprived quintile as well. And as you know, sort of with the poverty of socioeconomic poverty, there's poverty expectation, ambition, and outcomes as well. So we have this great paradox, an area of outstanding beauty, but within 10 to 15 miles of significant deprivation. It's a bit grim. However, is it? Well, these are pictures within 10 miles of where the hospital, well, absolutely stunning and beautiful countryside. You may have been watching the River Walks program on BBC iPlayer with Stuart McConey. Again, the first episode was a river within the East Lancashire as well. Really, really beautiful. To the top there's Stonyhurst College, that produces England rugby teams, but the famous pupil there was Arthur Conan Doyle, the author of Sherlock Holmes, as you know. To the bottom left, you may well remember this, is J.R. Tolkien's Lord of the Rings. Now, J.R. Tolkien's son trained to be a Jesuit priest at Stonyhurst. You may well be aware that Tolkien took 16 years to write The Lord of the Rings, and he spent a lot of time writing that in Stonyhurst. And a lot of the backdrop of the Lord of the Rings was based in and around East Lancashire. Now, I know they spent millions of pounds filming it in New Zealand, but for £80, they could have filmed it in Blackburn as well and got a better deal, I would think. Top right, in at Whitewell, lots of different programs, but that's apparently where the Queen goes occasionally for informal holidays. Bottom right, Gawthorpe Hall, next to Burnley Football Club, Premier Division team. You may recognise the architecture. This is by a guy called Charles Barry, who designed the Houses of Parliament in the 1850s, but also designed the building that was used as Downton Abbey in the films as well. But this is my favourite. Empire State Building, iconic building. The bricks that made this building were made in Accrington because they're so tough. Also the bricks that made the Brooklyn Bridge. So this is East Lancashire, powerhouse of the Industrial Revolution. So from 2019, good place to live, happiest place to live as well. So maybe it's not all that bad. So that's the health economy. Large, no one knows where it is. Lots of wealthy people living in beautiful parts of the world, but profound socioeconomic challenges as well. So the Trust East Lancashire Hospitals, this comprises Royal Blackburn Teaching Hospital on the left and Burnley Teaching Hospital on the right as well. These merged over 15 years ago to become one of the largest trusts in the country. And we serve a population of over 500,000, and we are a large institution, probably one of the largest hospitals in the Northwest as well. And so the top left is the Blackburn site. This is the acute site, a large emergency department. There's a helipad just to the right of that yellow ambulance. Lots of all the acute services as well, intensive care, medicine, surgery. This is where our COVID patients have been looked after as well. 11 miles down the road, and if you're a student here, you get a free shuttle bus that takes 20 minutes to get to Burnley, which houses an award-winning maternity unit, as well as a neonatal unit and lots of elective surgery as well. These are award-winning places. And like any health economy in the United Kingdom, the sort of the main trust are supported by other units. And there's a hospital here, Rossendale, which has clinics, endoscopy units. To lower down is a dialysis unit, Accrington. To the bottom right is a neuro rehabilitation unit on the Burnley site, and then Clitheroe Community Hospital. So you're getting this sense of a health economy with a sort of large trust supported by community hospitals. And these are areas where students get a lot of their education and training. So we have one of the busiest emergency departments and medical assessment units. We look after over 600,000 patients, largest intensive care. We do a lot of regional subspecialty work for over 1.7 million people. And the HSJ, that's the Health Service Journal. Apparently, we're one of the top 5th places to work in. So that's the organisation as well. And in 2019, it was awarded a good outstanding. Now, just put the red thing there, care quality mission. Guys, it may be worth just reading up briefly about that for your personal statement so you're aware of it. This is a government organisation that just concentrates on standards of care provided by different facilities. So the education department. So guys, when you're throughout your clinical training, initially you'll have some sort of lecture-based interactions with patients or active patients. But once you go into the workplace, you'll be sort of looked after by the teams there. And I'll quickly go through what you'll to expect. But this is your journey through medical training. You'll spend 4 to 6 years at medical school, and this is in preparation for what we call the foundation years, 1 and 2, and then you start subspecializing, whether you want to go into primary care GP or specialist training as well. And so what our aim is to prepare you, the students, we call it, for foundation year 1. We want you to be in the right place for when you enter the clinical area, i.e. preparing for practice. And that's a lot of what we're geared to do. And so we are the teaching hospital with the University of Central Lancashire, but also we take students from Lancaster Medical School, which you'll hear from later on today as well. So again, very similar curriculum, but 2 different types of students as well, and we enjoy having both cohorts. And there's also a medical school at Burnley to support this activity. So as you can see, what's emerging is a large health economy committed to developing medical students in East Lancashire as well. And in the Guardian, University Guide of just last year, there are 4 medical schools in the Northwest, and UCLAN came top and Lancaster came second. So hopefully we're contributing to what we believe are good medical degrees. And so when you do come to an organisation, you will be supported by what we call doctors who are trained in education, medical education, who will oversee your education and training here and make sure it's a high quality as well. And they will come from different backgrounds. And they will be supported by an admin team who will be looking after you on a day-to-day basis, telling you where to go, what time to be there, etc. And then you'll be taught and trained by lots of different people from different backgrounds to give you the different skill sets that you need to go into your preparation for practice and then the foundation school as well. And again, supporting you in the clinical workplace, again, in all the areas, you'll have a team of well sort of trained educators, making sure that you're getting the maximum experience in the different areas that you're in, and also looking after you from a pastoral point of view as well. Lots of junior doctors who graduated want to get involved, a bit like Abdul and Imran, in teaching medical students once they've gone through the foundation years, and they're the future educators, and they will be supporting education and training as well for the time. I mentioned the foundation years. We have one of the largest foundation schools in the country. 70 join us every year. And lots of these individuals want to get involved in teaching students because they can remember what it was like as well and what the challenges were. So it's really good getting these young people supporting you in making sure you get all the skills required to pass your exams and beyond. And they do support that. So again, we're getting this perception of an organisation committed to supporting our students as well. And the principles we apply is that we work very closely with primary and secondary care, as I think this meeting demonstrates. We really want a high quality program for our students, but what we feel really strongly about is the pastoral care we give to our students, because times are tough anyway, not least with the COVID pandemic. And it's important that students, if they're far away from home or even near, home is nearby, we make sure that we look after them as well. And if you were to type journey into Google Images, this is one of the many pictures you get. And you're on a long journey, probably since the age of 15. You've been making a lot of sacrifices to again what's required to get into medical school. It's challenging. There's no doubt about it. It's difficult. It's a marathon. It's not a sprint. And you need to be multi-talented and focused. And often as part of life and being human, you'll come up against obstacles that you think are sort of pretty insurmountable, be they academic, psychological, social, or otherwise. Where we are as a team is here to support you to get through this and be the best that you can be. That is our role. And this is what we call adult education. We want you to be the best that you can be, but you will help us achieve that. And so if you look at it, this is the General Medical Council booklet. This is outcomes for graduates, well worth the reading. It'd be important for you to read, because the General Medical Council are responsible for ensuring the quality of education and training of medical students and doctors as well. And what we want our students to be for the 21st century is competent, confident and professional. Competent, you know what you're doing. Why? Because you've been shown how to do it, you've been assessed how to do it. And so that when it comes to the situation that's required certain aspects, you're well able to deliver it. But equally important is knowing when you don't know what you're doing. And that's part of being a professional, when you escalate it or pass it on to somebody else. And we do that even now as consultants. Confident, not arrogant, but confident you know that you'll be able to deal with certain situations, again, because you've been shown how to do it, you've been assessed how to do it as well. And then having the confidence to say, I'm not sure what to do here. And again, this feeds into professionalism, where we're developing professionals who people will look up to as well, in the same way as that you look up to probably medical students and doctors who you've met, and that's who you want to be. But underpinning this, it's so important that we're dealing with human beings. We're not dealing with a diagnosis or a collection of problems. We're dealing with human beings within a family unit, a community unit, society and beyond. And we must have this holistic approach in looking after our patients, underpinned by humanity as well. We must never, ever lose sight of that. Just have a read of this. So important. The great and late poet Angela Mayer, who really summarized the importance of how we treat people and communicate with them as well. So learning live. So you're in the clinical situation, and so the areas that you go, it's not a random collection of events, because what we need to do is deliver what the General Medical Council require us to teach you so that you can do. And this is what we call the intended learning outcome. So what we do is design programs that map the curriculum onto these areas. So going to a clinic, a ward round, into a GP surgery, etc. So everything is really thought through. And because you're going into a clinical area, it's busy. We give you skills to develop how to learn on the job, and sort of say, look, I'm going to go into an area, this is what I want to learn, so-called purposeful observation. And you will come across instances, occasions that you will never get from a textbook or online learning. You know, the experienced ward sister dealing with a confused, frail 90-year-old man, the consultant explaining to a 32-year-old mother of 3 that she has got cancer of the breast and has not got long to live. The experienced registrar dealing with a really sick patient, and you'll see how people deal with that and the importance of communication and dealing with things sensitively as well. The hidden curriculum. Well worth the read, Matthew Said. Like anything, if you want to be good at something, you have to work hard at it. There's no two ways about it. And that's why we call it the practice of medicine. By practicing and practicing and practicing, you get better and better. And we still do it, even sort of 4 or 5 decades on, we're still learning as well. And to quote a famous musician, no difference. If you want to be good, you have to put the hours or the hard yards in as well, and you'll be able to do that. And so there'll be lots of different scenarios. There's not many socially distanced photographs you can get online for teaching areas, but there'll be a lot more coming on. But throughout this, you'll be involved in working with clinical teams, looking after patients, their families, etc. as well. And so important, the art of communication underpinned by science. And again, that will just run through the whole of your course as well, so important. But as we know, the perfect storm of COVID, there's been some challenges to delivering medical student education, but the government has mandated that doctors are key workers. It's important that we continue educating our medical students to produce doctors of the future. So a lot of things have been developed as well. Simulation, using HoloLenses where people go in with some technology that can be transmitted to lecture theatres as well. Lots of different new things coming on board. But looking to the way we treat our medical students in developing them with the general medical council in mind, these are photographs. The top, you won't recognize any of these for, but what this is about is the top two characters are botanists. They're the guys that do the lab work. They're the guys who invented the Pfizer or the AstraZeneca vaccine as well. But the gardeners below, they're the ones that undertake clinical practice as well, and they'll be the ones looking after the patients, delivering the vaccines as well. And as doctors, we are both scientist and practitioner, and we flip from one to the other. And in the clinical areas, be it in an endoscopy unit, a ward round, a clinic, a GP surgery, you'll see as doctors, we're using the available science to underpin our decision making as well. So scientist, practitioner, botanist, gardener. Dragon's Den, I'm really sorry, guys. I think most people are Netflix and Amazon now, but you may remember Dragon's Den. This is just something about developing people to be able to present their case in rather stressful situations, which when people are ill, it can be. So this is actually communicating with other professionals in what we call medical handovers, using certain techniques in getting across important information to other professionals when we look after patients. And we give you those skills and develop you in able to produce this good communication. The Apprentice, this is about teamwork and leadership. It's important that we develop you as what it is as good leaders of the future, a bit like Abdul and Imran already now leading this program, but also what's the importance of being a team player and what are the characteristics required, because healthcare is delivered by teams. You may not remember this guy, he's a little bit older, but it's Sherlock Holmes. Sherlock Holmes was described as a high-functioning sociopath. Not the most empathic individual, but he had incisive reasoning. And that's what we call about clinical reasoning, applying it to the workplace. Because what we do as doctors, we hopefully provide high-level decision-making based on clinical reasoning. So the drafts analogy, that's very sort of two-dimensional protocol delivery. What we aim to do is develop people so that they can play intellectual chess where they reason things out. What's the likelihood of this? What's the probability of this? How much importance do we have to put on that particular piece of information in our decision making as well? So this is clinical reasoning, again, which we like to develop. But understanding as medical students going into doctors that will be part of a healthcare team, and lots of different people contribute to the delivery of patient care. Allied health professions, pharmacists, physiotherapists, radiographers, and then nursing care as well. It's important that people understand the skill sets of these various members of the teams and also understand what they bring to the team as well. So throughout the time as you train clinically, because you'll be working together in the future, you'll be training together in certain areas. Likewise, you'll be educating each other as you learn and you go through the clinical training program as well. My son lives in Madrid, and this is before social distancing. This is one of many ceremonies every September about the human pyramid, but this is what people can achieve when they work well together. And because our outcomes are patient care, this is really important. I'll just go back one. But also developing you as doctors and doctors in the future, obviously, is the important patient-doctor interaction. But then as you're on a ward or in a GP practice, you look at a broader view of health in the community as well, and running the hospital as an organization or a GP practice as an organization. And then ultimately on a national and an international level as well, we start understanding medicine on a global issue, as the pandemic has really highlighted. And again, this is important. Lots of stuff about the zero tolerance towards bullying, discrimination of any form. There's a lot of information you get about patient safety. For example, the PPE in the COVID pandemic in hospitals, the importance of social distancing, washing our hands, etc. You'll start to learn about data protection and patient confidentiality. And then this idea of safeguarding. Some patients are more vulnerable than others because certain disabilities are unable to express themselves. And so we need to be aware that patients do need to be looked after. And then this idea called whistleblowing, where if concerns are being raised but not being listened to, that patient care isn't as it should be, then there are processes to support people raising concerns. Again, NHS values, I would certainly recommend this for reading and incorporate into your personal statement about these are sort of the values that underpin the NHS as an organisation in delivering patient care. Working together, everyone counts, compassion, improving lives, respect and dignity, and commitment to quality as well. So do have a good read of that. And there's something about culture, organisational culture, because when culture is not good, bad things happen. And in our world, in GP land and in hospital land and beyond, and in the nursing homes, you'll have come across it in the media as well. It's important to have a good organisational culture. So we support, and to achieve that, we support each other to achieve greater things, but also challenge each other professionally and in the right tone to make sure that we are doing the right things for patients as well. Again, Stu, you'll learn more about this in the in clinical environments that you've been trained in, because as we go through undergraduate and postgraduate training, you can sort of divide training into knowledge, which we can pass on, skills, which we can train, but also the developing the attitudes and the attributes that will make you a good functioning member and leader of a healthcare team as well. And this is really important. Be aware of this. Civility saves lives. There's a lot of evidence emerging that how we work together and treat each other does determine how patient care is impacted upon. And that you'll become much more informed about that. And then again, the importance of raising concerns, that if things aren't as they should be, the General Medical Council sees a professional duty for us as doctors to raise concerns. And again, I would recommend some reading around that as well. And then Robert Francis, who did a big investigation into the mid-staff's scandal at the hospital, said that it's about ensuring that patients are safe, cared for, and have a positive experience. But it's not just patients who are in hospitals, it's about how we treat their relatives, the carers and the friends, how we look after staff. Do we listen to them, engage them, and support them? But also trainees that come to our organisation, such as the medical students and the junior doctors as well. So you can see, again, as well as delivering knowledge, skills, it's developing you as professionals and leaders and what that means as well going into the workplace. And then you can join into days like this where you can give back and support, like Abdul and Imran, where you can feedback and support youngsters who want to apply to medical school as well. Lots of activity going on there. William Butler Yeats, first Irish poet laureate. I'm giving away my background here. But this is about inspiring the next generation of doctors to be the best that they can be, because as the guys have already said, you will be looking after us and we want the best as well. So that's our aim again. And also you will have an epiphany where you will meet somebody, a doctor, you think, that's who I want to be. A very, very powerful moment if it's not happened to you already. And you will be role models of the future that people will be looking to. Great responsibility, but challenging as well. So medicine, it is complex, it is beautiful, and so is the training to deliver it. And a lot of the program in the clinical areas that you will go wherever in the world, whichever medical school you go to, that's what they will be aiming to deliver as well. So where we are, it is very busy. However, as a consequence, you will learn loads. It is a great irony. If we want to be good doctors, we need experience. To get experience, we need ill patients. So therefore, patients have to become ill as well. And that is a great sadness. Working in East Lancashire, you'll have a really good time, very, very friendly. You'll make some good friends as well. But also you'll be part of a healthcare team that will have a a profound impact on somebody's life as well, and that'll be well worth enjoying that moment and understanding what healthcare delivery is about. COVID has brought into focus, I think, many things on many levels, but particularly related to health, global health, access to healthcare, politics, ethics, science, kindness, compassion, resilience, innovation, ultimately humanity and what it is to be human. We will learn from this, and your generation will be leading in this endeavor as well. So no pressure, guys, but looking to the future, you will be the future as well. So I wish you all the very best on your journey. Thank you for asking me about, and thank you for your attention.
Dr. Lynch, thank you for that excellent talk. I've just noted there's one question there, specifically about early clinical contact. Could you just kind of explain to our attendees how early is patient contact at UCLAN?
In years one and two. So essentially, again, you will obviously, they'll be talking about communication skills, giving you the skills to go into the clinical workplace and talk with patients, because that's quite nerve-wracking. But then there'll be what we call community placements, where you will be introduced to sort of areas where patients are, people who are vulnerable are, and with the locality-based educators or the tutors, you will be speaking to patients. So very early on, and then that's reinforced in year two, and then obviously years 3, 4, and 5, it's full on. Lots of medical schools do sort of ensure people get that exposure early on as well, and it's increasingly so because it's real medicine and it makes it real as well. I hope I've answered your question.
Okay, all right. Okay, thanks, Dr. Lynch, for that.
Pleasure. Thanks for asking me. Best of luck, guys.
Thank you, Dr. Lynch.